Hi there, and thank you very much for staying with us right here on Medical Today with me, Jared Rudnam. We just spoke about mental health in the aging population. We now are going to move on to advancements in IVF technology, and over the last 2 decades, we've seen a lot of strides in regards to infertility problems and how we are overcoming it, bringing about a lot of babies being born on Earth. Now, is that the only options? There are lots of options. And to talk about this, we have our on-site host, Nurata Amin, who spoke to Dr. S. Silva, a resident consultant, obstetrician, and gynecologist from Makota Medical Center. They were joined by a patient, Miss Lee Siu Fa, talking about infertility and gynecology, or rather its disorders, and how to overcome it and treat it. Let's take a look at that interview.
It has been more than 4 decades since in vitro fertilization, IVF, was introduced. Despite improved success rates of assisted reproductive technologies, the argument for performing laparoscopy as a part of the infertility over the recent times are gaining popularity with success rates. Thank you for being with us on Medical Today, Dr. Silva. So could you share the movement of technology in recent years over gynecological diseases?
Okay, the first baby, Louise Brown, was born in 1978. So that's almost 4 decades ago. She turned 40 last year, so she's 41 this year. So in vitro fertilization has improved tremendously over these last 4 decades. At the beginning, success rates were very low, but now with improved technologies, we have very, very good success rates. But in certain gynecological diseases, we need to perform surgeries to correct the disease before we move on to do, say, IVF or for the patient to conceive. And that's where the other technological advancement is, which is laparoscopic surgery or keyhole surgery, which will be able to improve pregnancy rates further in infertile patients.
Yeah, that's a good one. But what is laparoscopic surgery in the first place?
Okay, traditionally when we talk about surgery, we are looking at cutting. We either make a vertical cut or a horizontal cut. That's the impression that you get when you talk about surgery. But in laparoscopic surgery, what we do is we make small incisions, very small incisions in the abdomen. The biggest usually is only 10 millimeters, so 1 centimeter. Then the remaining are 5 millimeter holes, and through that we can do all kinds of surgeries, very different types of surgeries. That is what we call as laparoscopic or keyhole surgery.
So on top of that, why would you encourage your patients to undergo laparoscopic surgery compared to other kinds of surgeries?
Okay, there are many advantages of laparoscopic surgery, especially in patients who are trying to get pregnant. Now, one of the biggest advantage, one of the difference between laparoscopic surgery and laparotomy or open surgery is that in open surgery, we make a big cut, we put our hands in and perform the surgery. Whereas in laparoscopic surgery, we are making a few small incisions, and through that incisions, we are performing surgery. So we are not placing our hands in the abdomen. So the chances of what we call as adhesions, the intestines getting stuck to the uterus, the fallopian tubes, the ovaries, are far lesser in laparoscopic surgery than in laparotomy. So that's the reason why if you perform laparoscopic surgery for a patient who is not having difficulty in getting pregnant, their advantages is tremendous, because the chances of them getting all these adhesions will be lesser. They can get pregnant on their own with this one, without even IVF. That's the benefits of laparoscopic surgery, especially for infertile patients.
Right. So in detail, how is laparoscopic surgery performed?
Okay, traditional surgery, as I said, you make a big cut, you look down at the abdomen or the pelvis, and then you perform the surgery. Whereas in laparoscopic surgery, we are making small incisions. And what we do is, the first incision, we usually make it in the belly button, inside the umbilicus. Okay, we put in a tube called a trocar, and then we put in a telescope and attach the camera to the telescope. And through this telescope, we are looking the contents of the abdomen and the pelvis on a television monitor. So we are not looking down in the abdomen, we are looking at the television and looking and performing the surgery. So now that we have the view of the pelvis and the abdomen on the television screen, we place in another 2 or 3 incisions, place in instruments, and through that instruments, looking at the television, perform the surgery. So it's entirely different compared to laparotomy. So laparoscopic surgery, basically we are using a camera, a telescope, to look into the abdomen and then perform the surgery.
Right. Okay. So, you've been mentioning a lot about the advantages, but I think among others. So, what are the disadvantages, the other advantages as well of laparoscopic surgery?
Yeah, the biggest advantage.
Any side effects?
I will talk about side effects. Well, let's talk about advantages first. Let's talk about the good news.
Yes.
So, first is nobody likes a big cut. If you have a big cut, you will have a lot of pain. Okay, so if you make small incisions, then the pain factor, post-operative pain, is lesser. So all my patients who have undergo laparoscopic surgery, they go back the next day, as opposed to if you do a laparotomy, they will suffer a lot of pain for a few days before they go back. So pain, nobody likes pain. So laparoscopic surgery, the pain is far lesser than laparotomy. Of course, nobody likes big scars in the abdomen.
Yes.
All right, so cosmetically, laparoscopic surgery will be very, very good. In fact, nowadays we can even do something called single incision laparoscopic surgery, which means we just make one incision in the belly button, put all the instruments through the umbilicus, and then do the surgery. So you can't even see any incisions. You can do something very big, major, and still have a scar hidden in the umbilicus. So cosmetically, it's fantastic. That's
Now I'm imagining the diameter.
Okay.
The size of it.
It usually is about 10 to 15 millimeters in the umbilicus. So this is the second biggest advantage. Of course, the patient, because of less pain, they can get back to work faster, they can go home faster, they pass wind faster. Nobody likes to have wind in the abdomen, especially when you do a laparotomy. And the other biggest advantage that I said earlier is that the chances of adhesions, especially in infertility, infertile patient, is much lesser. So the chances of them getting, for them to be able to get pregnant on their own is far better when they undergo laparoscopic surgery than laparotomy. So these are the advantages of laparoscopic surgery.
Right. So, being a woman myself, of course, what are the different types of women conditions for which laparoscopic surgery can be performed or cannot be performed?
It all depends on the skill of the doctor. Okay, the more skillful he is, the more surgeries he can do by laparoscopy. But generally, the surgeries that we do, the diseases that we do laparoscopic surgeries are fibroids, ovarian cysts, that means water cyst or chocolate cyst in the ovaries, diseases like endometriosis. These are common conditions that we do laparoscopic surgery. Patients who have difficulty in conceiving, for example, the fallopian tubes are blocked, we can go in by laparoscopy and clear the block. Of course, the more advanced surgeries are removal of the uterus. Even for cancer patients, we can do by laparoscopic surgery. So there's a wide variety of cases women's diseases that we can deal with laparoscopic surgery.
Right, doctor. How about the women conditions, the level or the stages? Is it during the early stage or towards the chronic stage, then only perform laparoscopic surgery?
We don't operate on every gynecological conditions. There are some conditions that don't need operations. For example, a patient's fibroid is small. Even if she wants to get pregnant, there's no necessity to do the surgery. But if we think that it is going to interfere in her chances of getting pregnant, then we will advise surgery. The more chronic the condition is, for example, if a patient has got a severe endometriosis, then surgery is advisable before we proceed to say IVF or a patient to try to get pregnant. So we will assess. It's not that every patient with every condition we want to perform surgery, but if the condition requires surgery, laparoscopic surgery in my hands will be the first choice as opposed to performing laparotomy, because as I said, the benefit of laparoscopic surgery, especially in infertility patients, her chances of conceiving on her own, even without assisted reproductive techniques, will be better. So that's the reason why I would promote laparoscopic surgery.
All right, but since you're already at it, how does it benefit an infertility patient?
As I said, besides the fact that it's less painful and cosmetically it's better, the chances of her having adhesions That means post-operative adhesions. Adhesions means the intestines getting stuck to the tubes, the ovaries, will be far lesser. So that means she will have a better chance of pregnancy. That is the biggest advantage of laparoscopic surgery when we are operating on infertility patients.
Okay, so we have IVF, we have laparoscopic surgery, right? So when will you consider a patient who needs IVF instead of laparoscopic surgery?
That's a very good question. The reason is because we as doctors, sometimes we have this dilemma as to when the patient has a certain disease, which will be the better choice. My policy is always the age of the patient. If the patient is older, when we say older, is more than 37, say 37, 38, 39, 40, sometimes surgery will not be beneficial for these patients. So we probably move to do IVF earlier than in a younger patient. For younger patients with gynecological diseases like fibroids, endometriosis, I would recommend laparoscopic surgery because my aim is actually for me to perform the surgery and then for the patients to try to conceive on their own instead of moving on to IVF. But sometimes even in younger patients, if the disease is very advanced, we may need to do the surgery and then proceed to IVF. Sometimes I may even consider that this patient does not require surgery but move on straight to IVF.
Right. So IVF, in vitro fertilization, what is it actually, doctor?
Okay, basically for pregnancy to occur, first of all, there must be sperms and there must be egg. And there must be a place for the sperm to meet the eggs, which is the fallopian tube. Now, if there is certain conditions that causes these two not to meet, for example, the husband's sperm count is very low, or the lady is not producing eggs, or there's no place for the eggs and the sperm to meet, then we have to move on to IVF. So these are the conditions in which we perform IVF. The absolute reason is if both the tubes are blocked, then there's no place for the sperm to meet the eggs, then we have to do IVF. If the husband's sperm is very, very low, then the sperm is not strong enough to reach the egg, or the patient is not producing eggs properly, then we may need to move on to IVF. So these are the common reasons why we do IVF.
So how about like few first miscarriages?
Miscarriages are different reasons. Miscarriages usually is because when the egg meets the sperm and the embryo is formed, the embryo has got a problem, and that's the reason they miscarry. That's one reason. Or maybe there's some defect in the uterus that's causing the miscarriages. So we need to study the cause of the miscarriages. And it doesn't mean the lady has got multiple miscarriages, she must do IVF. And IVF will not improve her chances of miscarriage. You understand what I mean? So it is not necessarily that the patient has multiple miscarriages, we have to do IVF. So the concept of IVF is that we are actually stimulating the woman to produce eggs. We collect the eggs, bring it outside, and we fertilize the eggs with the sperm in the laboratory. And that's why it's called in vitro. In vitro means outside the body. Fertilize the eggs and the sperm, and then put the embryos back into the uterus.
Right.
Okay, so that's the whole concept of how IVF is performed.
All right, this is the fun part, okay? Last but not least, just yes or no answer, doctor. Is IVF pregnancy high risk?
No, it is not.
Do IVF pregnancies have a higher miscarriage rate?
No, it is the same as normal pregnancy.
Right. Can IVF cause birth defects or increase birth defects?
It doesn't increase birth defects.
Thank you, Dr. Silva. For more information on both topics and answers, do contact the good doctor. So this is Medical Today. So, what circumstances that convinced you to undergo laparoscopic surgery when there was already alternative or conventional treatment back then?
Yeah, I was diagnosed endometriosis in year 2000. What I understood from doctor that this laparoscopy is a keyhole surgery. It is very safe. Okay, small hole. Okay, then less pain and shortened recovery. So when I first heard about this laparoscopy, I think it is perfect because I can go back to work very earlier. So without any further consideration, I just opt for laparoscopic, not conventional methods.
Right. So that was your first time, right?
Yeah,
your
first
first
time.
experience.
Yeah.
So can you share with us your fears, your emotions, your hope, and your experience during the laparoscopic surgery?
Of course, I believe that anybody who is undergoing surgery would be very worried. My main fear about this surgery is the outcome of the surgery, whether it is benign or malignant. Basically, I have no fear to undergo the surgery because I have full confidence with Dr. Selva. He is the best. Yeah.
So how was your post-surgery experience?
Well, I think I recovered very fast within 2 weeks, and I went back to work after that.
Seriously?
Yes.
So how did the doctor react to that? Is it normal?
It's normal.
It's normal.
Yeah, it's normal. Yeah.
Okay, so would you recommend laparoscopic surgery to your friends, and when do you think you should actually recommend to them?
Of course, I will recommend and share my experience and recommend to anybody who need it anytime. Yes, because I find this technique is very good.
I say, like for example, how would you actually know that you need laparoscopic surgery?
Because
Let's say before they need to see the doctor, maybe from your experience from a friend.
they need to consult the doctor. I
Oh,
think-
they need to?
Yes.
All right.
Whether it is suitable to undergo laparoscopy. I think laparoscopy is the latest technology. It's very good compared to the conventional method.
So you do need, of course, a decision made by the experts, yeah?
Yes.
So what were your worries and your expectations when you were going through IVF? It was your first time? You had 3 times?
Yes.
10 years ago?
Yeah, 10 years ago. Of course, the expectation will be, I want to have a baby. I want to conceive. Okay, I went through IVF 3 times in 3 years in a row. Okay, I think the main fear will be the physical suffer. It's not only from physical suffer. Mainly will be more on mentally suffer because we have to go through the whole procedure. It's not because we can afford to pay the whole total cost of the IVF procedure. It's whether we can go through. It's whether we can, our eggs is big enough, or the embryo is healthy enough, or what would happen after the transfer, whether I can conceive or not. But finally, I conceived in my 3rd time IVF.
Congratulations.
Yeah, thank you.
So, son, your daughter?
Son, he is 7 years old right
7
now.
years old. What's his
Yeah.
name?
Kaylen Chua.
Hello, Kayla Chua. All right. Okay, have some coffee.